Big week ahead. Senate Republicans are releasing a new draft of their bill to repeal the Affordable Care Act. The revamped version keeps some Obamacare taxes in place. It adds funding for the poor, as well as money to combat the opioid epidemic. But Senators Lindsey Graham and Bill Cassidy say that they have a better idea. They've introduced an alternative plan aimed at winning bipartisan support. Senator Lindsey Graham joins us right now to talk more about that. Senator, it's good to see you. Thanks so much for joining us.
Good morning.
How do you think this plan, go through your plan, tell us what's important and why you think that will gain bipartisan support so that you can get this bill to the president's desk.
There you go. Well, all the money that we were going to be spending in Washington, we block grant to the states. It's pretty simple. We leave the taxes in place, except for the individual mandate and the employer mandate and the medical device tax, which hurts innovation. We take all that money and we send it back to the states and tell them, you devise a plan for South Carolina and California. If you want to go Obamacare route, you can. If you want to do something different, you can. But we're going to let the people closest to the patient decide how to spend the money and get this stuff out of Washington. To me, that makes a lot of sense. Give it to the governors and say, you can't spend it on roads or bridges, spend it on health care. Good luck.
Yeah. No, I think that does make a lot of good sense. But, Senator, the fact is you've got colleagues on the right, Republicans, rolling their eyes, saying, why are we leaving any taxes in place that are currently in the Affordable Care Act? I want to play you a little clip of my interview with Senator Rand Paul and get your reaction to it, because Senator Paul basically says, look, I'm a no vote on this. And the reason is because it looks a lot like the Affordable Care Act. Here it is. Watch this.
What we have to decide is it the government's role to subsidize insurance and insurance companies. I don't think insurance companies should get a penny of our money. I mean, they made $15 billion a year in the group market. They segregate a very small part of the insurance market. They whine. They come to Washington and say, we need money. Oh, we want to help everybody, but the taxpayer has to pay us to help everybody. So it's this false sense of magnanimity that sort of says, oh, we're going to help everybody. But in reality, what the insurance company wants is a big bailout. And I'm not for bailing out any U.S. industry. I love American companies. I love American companies that make profit. But I'm not for giving any of them any money, because that's simply crony capitalism.
But is there a bigger issue here, Senator, the fact that you have a big agenda that you need to execute, that the American people voted for in November? They want to see a repeal and replace, but then they also want to see tax reform. If you hold up the progress in terms of getting a bill out, getting a bill to the president's desk, do you jeopardize getting the rest of the agenda done?
I think there's a possibility that Republicans will shoot themselves in the foot by passing something that actually doesn't fix Obamacare. So I think actually I'm not advocating nothing, but nothing would be better than this bill, because the death spiral of Obamacare is based on one fundamental flaw, and that is that you can buy insurance after you're sick, and that we have these regulations that make insurance expensive so young, healthy people can't buy it. That death spiral leads to adverse selection and the rising premiums in the individual marketplace. That will continue under the Republican plan. They will simply subsidize the death spiral. That's what this stabilization fund does. The Republicans are acknowledging the death spiral of Obamacare will continue, and they're going to subsidize it. There is nothing Republican about that. There's nothing conservative about that, and I won't be part of that. If they want to take their nonsense, their big government spending programs, their throw the kitchen sink at everything, and put it in another bill and work with Democrats on that and tell conservatives we'll have a clean repeal, I'll vote for any variation of a clean repeal. I want 100%, but I'll vote for 50%, 75%. But I'm not voting to create new entitlements for insurance companies.
So what about that, Senator Graham? Doesn't this plan keep in some of those entitlements and certainly the taxes?
Right. So here's what I would say to Rand. He's a libertarian. I respect him very, very much. Obamacare was designed to lead to single-payer health care. They were going to make it so expensive for employers that they would drop coverage on their employees. They would go into state exchanges that were going to fail to be taken over by the federal government. We got one last chance to stop single-payer health care. So with all due respect to Senator Paul, we better come up with a plan that saves the private sector. The government is very involved in health care. It's called Medicare. It's called Medicaid. I've got one simple goal with my colleagues, is to save the private sector option for people who make too much for Medicaid and are not 65, to keep competition alive and well in the private sector. I'm not going to bail out insurance companies because that won't solve the problem. Senator Cruz's amendment will allow people to buy policies beyond the Obamacare policy. We're creating more choice. We're repealing the individual mandate, the employer mandate, which are the heart and soul of Obamacare. So this proposal by Mitch McConnell is not like Obamacare. My proposal is the ultimate Republican solution in this regard. We believe those closest to the patient should have the money and the decision-making authority. We believe that our governors and our state house can do a better job than a Washington bureaucrat. I don't mind putting money into health care to help people who are struggling. I just want the decisions to be made in their backyard, not in Washington. That's why I like my idea so much.
You and your colleagues are trying to slow down the growth of Medicaid.
Yes.
Walk us through what has occurred in this entitlement program. Most people, you know, when you hear from the left, they say, oh, they're cutting Medicaid. You know, people will die. Children will die. You know, and I don't think people fully understand what this program has become, Senator.
Okay. So here's where we're headed. Medicaid and Medicare are two federal government-run programs. By 2042, Maria, all the money that will be collected in taxes throughout the country will go to support Medicare and Medicaid. There'll be no money for the Department of Defense or Department of Education. Why? Because these programs are growing so fast. In 1997, the balanced budget agreement between Bill Clinton and a Republican Congress, what did we do to balance the budget? We slowed the growth rate of Medicare a small amount. Barack Obama, negotiating with John Boehner about a big deal, said that Medicaid and Medicare growth is unsustainable. Yeah. We're going to come up with a way to slow the growth. So there's a lot of games to be played in Medicaid. I want to keep Medicaid in place for the poor. Right. I want to give more flexibility to the governors. One size does not fit all. I want an inflation rate for Medicaid that's more sustainable. It's not a result of games. So Democrats, when they propose slowing the growth rate down for Medicare and Medicaid, it's good government. When a Republican proposes it, we're trying to kill people. Right. It's a game being played up here, and I'll tell everybody listening that if we don't reform Medicare and Medicaid, they're going to collapse and take the whole country with them.
All right, thank you so much, Lindsey Graham, for joining us there.